and welcome back. People who followed me a long time might recognise my guest today. This is Dr. Tapan Patel of the Phi Clinic, who I did one of my first ever videos with, so welcome back.
Thank you very much.
I was recently at an Allergan Beauty Decoded event with Tatler magazine, and I saw Dr. Tapan Patel on stage, and he blew my mind. He was talking about fillers, everything you could possibly want to know about facial fillers. So I put a call out to everybody on Instagram and YouTube, and I said, ask the doctor questions. Everything you ever wanted to know about facial fillers but were afraid to ask, if you were tempted to have facial fillers, this is the doctor that's going to answer all of your questions. So welcome.
And there's a lot of questions, I can see.
Honestly, I was shocked at how many questions, and also how intelligent and well thought out the questions are.
Good.
And I love that the doctor has not asked me to see any of the questions in advance, because he just knows his stuff. Right, so let's start.
Let's have some fun.
What exactly is filler?
The name says it all, you know, and it's not to overcomplicate it. There's a number of different types of filler. So there's permanent fillers and there's temporary fillers. We only typically use temporary fillers, and the most common substance is something called hyaluronic acid, which is a long technical name.
No, my followers are going to know what that is, because they use serums with it.
Yeah, they use it, and you see it in skincare. But when we use it in a filler, very simply, it's a sugar. Now, there's lots of different brands. We typically use a particular brand of hyaluronic acid, or HA. It's easier to call it HA. And we just place it in parts of the face where we've lost volume to just plump those areas up or add some support or structure. I think really fillers have become popular in the last 20 years when the first HA ranges came out. And I think what's happening now is people had a fear of fillers because they would go around and see somebody in the newspaper or in the media who'd had maybe work that wasn't very aesthetically pleasing, if I can say that diplomatically. And so people had an understandable fear. But what's happening now is that we are getting better at delivering the treatments, more natural results, natural expression, and because it can be so targeted and subtle, I think that's what's really stoking the interest.
I always say that the reason that so many people say, oh, fillers, pillow face, oh, fillers over plump lips, is because you only see bad filler.
Absolutely.
Good filler, you never see. It goes unnoticed. If you see a Hollywood actress and she has not aged from 35 to 45 or 50, the chances are she's had some beautiful, subtle work. It's just that you haven't noticed it.
Absolutely.
And that's the key of great work.
Yeah, and certainly in this country, I think we're quite conservative. People don't like to discuss what they've had done. We're quite private. So when I look at my own patient database, you know, most of the people that I would treat would say, I really wouldn't want anybody to know I've had the work done. And they're not discussing it. So I think within our various social groups, there are people out there who have treatment, nobody knows about it, they look good. And that's the whole point. Once you've had a treatment, the real hallmark of good work is that nobody can spot what you've had done, but they would give you a compliment like, you look well, you look refreshed, that type of thing.
You just look like the best version of you.
That's it, that's the aim.
So let's talk about how much filler is too much filler, because that was all of my followers, their main concern is, I'm so frightened of having filler because I don't want to look dumb.
Right, let me bust one myth right now. This is the most important thing I'll say. People look dumb not because they have too much necessarily. There's a number of factors. First thing is, even a small amount of filler in the wrong place will look bad. So it's not always quantity, it's where it's put. Secondly, it's how it's put in. Third, it's who's putting it in. So there's so many factors that can lead to a bad result, and people always blame too much filler. Now, over the last 3-4 years, Nadine, what's really been very game-changing in our practice, we're using much more filler than we ever used to use. So just 2-3 years ago, in my clinic, we might use 1 or 2 syringes or 1 or 2 mils of filler. Now, it wouldn't be unusual, I don't want you to faint, but it wouldn't be unusual to use 14 to 16 syringes. Maybe not all at once, but over 2 or 3 sessions. Now that sounds like a lot, and to a lot of even my practitioner colleagues, that's a lot. But when you think about it, 15 mils is a tablespoon, or 3 teaspoons. And when we're treating the temple, the cheek, under eye, lip, chin, jaw, that's not a lot of product. So, and that's not something that would need to be done all the time. But even when we do that, we can still make somebody look like they've had no work done. On the other hand, I've seen people with just 1 syringe, but put badly. or the wrong product or in the wrong location, and they can look done. So the most important thing, it's not the quantity of product that makes somebody look done, it's just poor technique or poor procedure, etc.
So whereabouts within the skin does filler sit?
So this is interesting. They're called dermal fillers. Dermis means skin, but actually the fillers don't sit in the skin. Well, 99.9% of the time they don't. We're now treating different structures in the face. So a quick tutorial. When we look at our face, there's 5 important layers. The deepest part is the bone, the skull, so jaw or cheekbone. Sitting on that, there's some deep fat. Then there's the muscle. Then there's superficial fat and skin. And 90% of the time when we're injecting, it's that deep fat that sits on the bone. So the reason for that is that's what starts to deflate. And, you know, as we mature.
Honestly, I look back at pictures of myself when I was younger and I had this big round moon face. Yeah. That's what you lose as you get older. Absolutely. I see my skull beginning to appear.
Well, it does happen, but also, and the skull. So don't forget, you know, our bone resorbs as well.
Yes.
So the reason we sometimes refer to little old ladies is that, you know, our spine shrinks with passing years.
And our skull shrinks as well, doesn't it?
So it does. And typically we see that most in the jawbone and the chin. So we can replace some of that support. So most dermal fillers don't actually sit in the dermis at all. They are volumizing fillers, and that's probably what they should be called, volumizing fillers.
Okay. Now let's talk about, you work with Juvederm here, let's talk about the different types of Juvederm, because people were saying, one of the questions I got is, how do I know if I'm getting the right filler in the right area? Because not all fillers are created equal to go in the same place. So there are fillers for lips, under eyes.
Yeah,
talk us through it.
Let me talk about the range I use. So as you mentioned, I use the Allergan Juvederm Vicross range. Okay, this is the sort of, in my opinion, and I've used a number of ranges, this is a very sophisticated, very well engineered range of filler. So what happens with this range is that we have different products, and how they vary is the concentration of HA within the syringe.
And does that make some different textures? So you get some that are very liquid and some that are quite thick and gelatinous, aren't they?
So if I start from the bottom, the mildest one, so to speak, or the sort of least concentrate, we call that VOLITE. Now that is very watery, and that is the one that we inject into the skin, and that is really for skin quality. So we put that into the skin to hydrate, smooth, make the skin more elastic.
That sort of gets rid of that superficial dehydration and crepiness.
That's the aim, that's the aim, to improve the skin quality. The next one is, so slightly more concentrate, is VOLBELLA. VOLBELLA is a beautiful product to use under the eyes, so for dark eye circles, but also to plump the lips in a very mild way.
So in areas of the skin that are flexible and the skin is quite fine?
Absolutely.
Okay.
Well put. Then there's one that's a little bit more volumizing, and we call that VOLIFT. And typically we would use that in folds, and where the amount of lift we want to create is not huge, so it's subtle work. Okay. The one after that is VOLUMNA, and for a long time, I think for a lot of people, that's been the workhorse. So VOLUMNA is used to help in the temple, cheekbone, the front cheek, jawline, chin, you got it. But what's really interesting is the new kid on the block, the latest member of the family, and that's called VOLUX. And that's the most concentrate amount of HA. And at the moment, we're typically using that in the chin and the jawline. And it's, you know, it's early days, but it is approved. So we've now got 5 different tools to choose from, which as a practitioner, it's great. It's
That's like perfect for you, isn't it?
It's like having a palette and a brush, and we can kind of tailor the treatment to the individual patient.
Okay.
Now, once we do it, the thing about the Vicross range, one of the things I really appreciate about it is its longevity. You know, when I first started injecting 19 years ago, some of the products were lasting 3 to 6 months, which meant that if I took 3 to 6 months to deliver the treatment, the first set of products would already be on their way out. So we'd never basically catch up. Now, if I take that range I spoke about, the VOLBELLA is lasting probably 12 to 15 months, the VOLIFT 15 to 18, and the VOLUMNA 18 to 24. It's a couple of years, you know, and in some patients, and depending on the location, it could last even longer than that. So what that allows us to do is deliver an initial treatment, and then we can just maintain the patient with smaller amounts of maintenance top-up.
And what happens to hyaluronic acid in the body?
It just breaks down naturally. As you mentioned yourself, it's a natural component of the skin. We all have HA within our skin already.
And joints and eyes.
Absolutely. It's a ubiquitous compound. And then so what happens is it's naturally broken down by the body, and then you just sort of metabolize it.
Is filler vegan?
Well, it's interesting. In terms of how it's produced, which is from a bacteria, and there's no animal testing, so yes, I have on good authority that the range I use is vegan, as am I. Yes, I am.
That explains why he's Benjamin Button and is reversing backwards. I've known you for so long, seriously, you're younger now than you did before. Is it safe to have while pregnant and breastfeeding? These are my smart followers' questions.
So no, I would never recommend that anybody seek treatment while pregnant or breastfeeding, and no practitioner should be treating under those circumstances anyway.
Okay, and it's not that it's not safe, it's just that why would you ever take even a 1,000,000 to 1 risk? It makes complete sense. Also, I have to say, when most people are pregnant and breastfeeding, their weight is fluctuating, and often the thing about having filler is you need to be at your optimum weight, because if you lose weight or gain weight, the shape of your face changes.
We say in the face, a millimetre is a mile, and so when you want some really good and accurate treatment, you're absolutely right. You know.
Can you fill just one line?
So that is how fillers first started. The idea was that, you know, people would just fill these lines, etc. It's not...
People are asking about the 11 line here.
Okay.
Lines. 11 is 2 lines.
So the reality is you have to look at people on an individual basis. Now remember that these lines are caused by muscle movement, and for lines caused by muscle movement there are other treatments. If it's an established line, there might be a arena in which that could be filled, but we've moved away, and most experts have moved away from just treating individual lines, because that's just treating the effect, it's not treating the underlying cause. So it's always better, you know, sometimes, for instance, we have a line here, but it's because the face has started to sag. And what we need to do is lift it. If you just add a little bit of heaviness to something that's already sagging, you just make it worse in the long run. So we've moved away from what we call chasing lines and filling holes to global structure and support. And
the first time I ever came to see Tapan, I said, and it was so interesting, I said, do you want me to bring a picture of the look I'd like? And he said, no, just bring a picture of you when you were 18 or 25. That's what I need to recreate. I don't need to make you look like Jennifer Lopez or Jennifer Aniston, which I would love.
Which you already did.
Thank you. See, flattery both ways. What I need to do is look at what you were like when you were 25. That's the face, that's the structure I'm trying to recreate.
And so let me tell you why photos are so important. You're absolutely right. The reason a photo of your own self from back in the past is useful, it tells us 2 really important things. When I look at somebody, that photo tells me what they did have. More importantly, it tells me what they didn't have. And I'll tell you what I mean by that. I could look at somebody, let's just take a theoretical patient aged 50, and I'm meeting them for the first time, and I notice that the lip is very thin. Now, at this moment, I don't know if their lip was always thin, or if it was quite plump, and now it's just become thin. So that photo will tell me, because if the lip was never big to begin with, it's not a good idea to try and recreate something that wasn't there. Same with the position of the eyebrows, same with the position of the jawline. So the photos are really good because they guide us to kind of how the person's face has changed and how we might try and recreate that look again.
And one of the problems with pillow faces is if you look at celebrities, and there are enough pictures everywhere of people that have them, is they didn't even have that face shape when they were younger.
Exactly.
So you're overcompensating, which brings me to another question, most commonly asked question. If you have too much filler, can it stretch and damage the skin?
So, I think the key word there is too much. Too much of anything is never a good idea. So, I
guess they're thinking of, if they're going to have the very large plump lips that are super fashionable, and then over time they change their mind, are they going to end up with a wrinkly old lip? That's what I think people are worried about.
So, although there's no study to show that, I think common sense pretty much dictates, and that's what we see in the clinic.
Okay.
So, our view has always been, when we're putting the filler in, we're replacing what was there, but now has become deflated. So if somebody shows me that, you know, when they were more youthful, their cheek was fuller, or their jawline was more prominent, when we put the filler back, we're just adding the support that is now gone.
Okay.
I would never over-enhance a feature, and the one you mentioned is the one we see most often, which is typically, and I hate to say it, young female patients who, for whatever motivation, end up getting lips which are 2 or 3 times bigger than they should be. Then you definitely get stretch of skin. And we know this from other parts of the body, that if you stretch the skin, damage occurs. We see it on, you know, tummies with stretch marks, you know, either from pregnancy or weight gain, weight loss, etc. So the skin has some degree of what we call elasticity, but you can't, you know, you have to respect that. So you treat within what that base can handle, but you don't want to push those boundaries, because when you do, you probably regret it later on.
Now, filler is reversible. Tell me how you reverse filler.
So, this is one of the more reassuring things about what we call the HA fillers, and that's irrespective of the band. But there is an enzyme that we can use, and we can inject it to reverse the filler. Now,
is it pretty much instantaneous?
To some degree, yeah, depending on how much you use and why you use it. Sometimes we have to do it because complications do happen during treatment, and it can be dissolved.
Okay.
So, you know, and that's one of the reassuring things. And I think when people hear that during a consultation, it adds that degree of relief.
Yes.
That being said, you know, it's not as straightforward as people think. So I would still encourage people not to think, oh, I'll have this treatment because if I don't like it, I'll just go ahead and reverse it. But it's kind of like a last resort.
Okay.
Yeah.
Okay. Is filler safe?
When we look at all the cosmetic procedures done around the world, dermal fillers, volumizing fillers, is probably the second most popular treatment performed worldwide. Tens of millions of procedures are estimated to be performed globally every year. Now, they enjoy an incredible safety record. You know, the very vast majority of these procedures just result in huge patient satisfaction. One of the things to understand, though, it is invasive in that there is a needle going through skin. When a needle goes through skin, your biggest risk is going to be bruising. So bruising can happen. Now, I don't consider bruising an adverse or a side effect. It's almost anticipated, but you know, in most scenarios, it will be short-lived and it can
absolutely
just go. And here's probably my public safety message. There are people now performing dermal filler treatments who are not healthcare practitioners, and you know, this is my.
So we need to talk about who, if you are thinking of having filler, there are only 3 groups of medical practitioners you should be seeing, and they are
doctors, dentists and nurses, because these are the only 3 groups of healthcare professional who can manage your journey. What I mean by that is, if you go to somebody and you get the treatment done, they should be able to look after you even if something does go wrong. Now, you will see on social media, you'll see on lots of websites, there are beauty therapists, there are chiropodists, there are physiotherapists, there are people even with no previous medical or beauty background administering these products. And they will give ridiculous arguments for what they are qualified to do it. They are not.
What worries me is I have low blood pressure, and what happens if I faint? I want to be in the hands of a medical professional that knows to put me into a recovery position, or if I faint and fall over, nothing to do with the filler process. I just think if you're having any sort of medical treatment, the slightest chance that something might go wrong, you need to be in the hands of somebody who at least knows how to look after you. It's something as so simple as that.
Absolutely, there's so many reasons. I mean, look, somebody comes for a treatment, there might be a reason not to treat.
Also, what happens if you have an allergic reaction?
Here's the thing.
You can prescribe.
We can prescribe
antihistamines, steroids, antibiotics.
So, you know, it's common sense. And
I couldn't imagine having a botched filler by some hairdresser or beauty therapist and then having to come to you afterwards and say, Tapan, I'm so sorry.
And I've got to be honest, you know, there is a duty of care that all healthcare practitioners have to their own patients. And, you know, we're going to put our hands up and say, things go wrong when we treat. Of course they do, but we know how to look after it. And even if we don't, we have colleagues we can refer to. Okay, so there is a network. Now, that network is a medical practitioners network. And this is what I would say, think very carefully before you are enticed by price or the offer of having your treatment with an unqualified practitioner. Because if something goes wrong, even something as simple as an infection, they cannot prescribe antibiotics for you. You will have to go to somebody else who may or may not be willing to take over your care, because actually they didn't start your treatment and they're not obliged to do so. So, you know, it is a little bit of madness in this country that the regulation isn't strong enough. We are petitioning Parliament to get better regulation. It's not there yet. But, you know, until that time, I think as practitioners, we have to get this public safety message, but as patients and consumers, there has to be a degree of diligence that you do when you choose who to go for your treatment.
And I think look at the initials after their name and Google it. And I always think go on I'm very much in the arena of being open and honest about any work I have done and sharing that network with people. If you have a great doctor, I dragged two quite well-known people up on stage the other day and went, you need to meet Dr. Tapan because he's treated me before and I trust him. And I think the more that we have an open, honest discussion, but honestly, just Google so much the practitioner you're about to go to, ask for before and after pictures, ask for personal recommendations. I mean...
I'm sorry, you're so right, I missed that point. Just because they're a doctor, dentist, nurse doesn't mean they're good. Of course, that's the bare minimum.
It means you're safe.
Yeah, it means the bare minimum. After that, you still have to make sure that they've got adequate training, expertise. And look, we all start somewhere. You know, when I treated my first patient, that was my first patient. But you're very candid about it, you explain. And I think as long as the person treating you is open and transparent, that's important. And yeah, but all the things you said, word of mouth referrals, testimonials, experience, looking at some of their work is really, really key.
I remember the first time I came to you, I said, you know, this is my face, and you took those sort of vivid, no makeup pictures before and after to keep an eye on my journey. But also you showed me other people who you had, obviously you had their permission to do it. You showed me other people who had similar faces to me. There's no good you showing me a 25-year-old and comparing me with them. That's not what you need. I've got some questions once you've had filler. Can filler move?
Okay, so...
Somebody was asking because they were having deep facial massage.
Right.
Can that filler move?
Okay, so again, I'll speak about the product range I use. Assuming it's injected in the correct place, with the correct technique, it won't move. Okay. However, it does take maybe 3 or 4 days to start setting, and then there's a period of what we call tissue integration. So where it's actually starting to become part of the tissue it's injected into.
And what period is that?
That's probably somewhere like 2 to 4 weeks.
Okay.
So what I typically advise my patients is they can do gentle self-massage even from the second day after the treatment. But you probably want to avoid something over vigorous for the first month following treatment.
Okay. Now, one of the reasons that Tapan isn't going to treat me today is because I'm in the process of testing radio frequency. The treatments that heat the skin, like radio frequency, oral therapy, are they okay to have if you've got facial fillers?
Absolutely, but you just have to respect the time frame that the practitioner advises. If I'm doing skin tightening or devices, like, as you mentioned, radio frequency, ultrasound, I like to do those first and then put the filler in.
Okay.
If you do them the other way around, it's fine, but you just wouldn't do it immediately. You probably typically wait maybe 3 months following the dermal filler, then it'd be perfectly reasonable to have.
Okay, that's fine. Earlier on was filler for dark circles, because you see so many amazing before and afters on Instagram. Is it quite an easy thing to do, or is it quite difficult to do?
Honestly speaking, we should do another video just on dark eye circles.
I know.
Okay, because there are so many factors. Let me give you the summary answer, and we can do this in more depth another time. The thing about dark eye circles is there's lots of different causes. It's not just hollowness. There could be pigmentation, there can be thin, crepey skin, there could be so many causes. The filler will help people whose dark eye circle is caused by hollowness. It may improve those other things, but it's not going to treat, you know, if somebody's just got dark eyes because there's a lot of pigment there.
Or the colour of their skin as well. Does it hurt?
Again, pain is very, very subjective, but we are very sort of interested in finding this out from the patient. So every time I do a procedure, I will ask the patient, look, give me a pain scale. 1 is no pain at all, 10 is the worst pain you can imagine. How did that feel? For almost 99.9% of patients, and I don't use any local anaesthetic or any numbing, maybe just a little bit of ice to cool the area first, our typical response is 1 or 2 out of 10. Because the needle is very tiny. Another nice thing about the Vicross range, the way it's been manufactured, we can actually push it out of the syringe through a tiny little needle. So, you know, some people do have a heightened pain sensation, but the vast, vast, vast majority of people would classify as very, very...
Do fillers have local anaesthetic in them?
They have anaesthetic in them. Now, of course, that doesn't help you with your first injection.
No.
But subsequent injections means that you're already starting to numb up in that area.
Okay, right.
Yeah.
Now I'm going to ask the most important question. How do you price filler? How much should we be expecting to pay? And I know you can't give me a specific filler because every face is very different, but are we talking about £50, £150? Do you price it up per syringe, by time? Give me a rough idea.
I could spend an hour giving you an answer here.
And it will be different from clinic to clinic, but I just thought I'd ask the question because I know you want to know.
The first thing is, we can't fixate just on the cost or the price. It has to be the overall service and value. So remember, you're not buying a product, you're not buying a jar of cream, you're getting a whole treatment. So there will be a huge range of pricing. And what you have to understand is you're not just paying for the product, you're paying for the experience of the practitioner, the technical skill of the practitioner, the before care, the aftercare, and the whole service, the whole patient journey.
I'm going to pin him down to a price.
Okay, so let me give you a broad range.
Starting at.
If I look around the country, I think, and I look at colleagues, people will say things like syringes starting from, and I think you're probably looking maybe £250 to £300 as the bare minimum. That could go right up to £1,000.
Okay.
Yeah, per syringe. So there's a huge variance there. As we've moved to larger volumes, as I mentioned, 12, 16 syringes, what a lot of clinics will now do is offer a package so that patients also understand what they're paying for in total.
Is it okay to ask up front and to say, can I ask you, if I come back and see you 3 times, how much is this going to cost?
You have to.
Okay.
Listen,
people don't like to talk about money.
No, they don't. And as British people, we're very reserved. We don't ask enough questions. People should be asking at consultation, sorry, how experienced are you? How much training have you done? Can I see some examples of your work? Nobody's ever asked me this, by the way, ever. And cost is absolutely paramount. You must have a clear idea of what your treatment's going to cost, how long it's going to last. All those things must be answered, because otherwise it can just lead to awkwardness later on, or misunderstanding. No,
I guess there would be nothing more embarrassing than coming out and finding you're going to have to pay £16,000.
Exactly.
This face would take a lot of filler, trust me. My bill's going to be huge. There you go. I knew he would answer all your questions absolutely perfectly. He does want to treat my face because since I've seen Tapan, he's been on a whole Allergan decoded, clever, amazing journey with this incredible doctor called Maurizio De Maio, and he wants to work on my face. But I trust him implicitly to do really natural, beautiful work. And when we do it, and if we do it, we will film it for you and show you some before and after. So thank you so much for today.
Pleasure's
I really appreciate it. Now, if you want to find your nearest Allergan, Juvederm, registered clinic, doctor or nurse, we're going to put the clinic locator below. You put your postcode in and it will come up and it will show you the person that's been through the proper registered training, and they've got the right products in their hands and you know that you can trust them. So we'll put that down below. Tapan will be obviously in it if you happen to live somewhere in central London. Thank you so much.
Thank you.
I appreciate it. We've taken up so much of his time. There's a queue of people around the corner now waiting to be filled. So thank you so much.
Thank you so much. Thank
See
you.
you soon. Bye.
Bye.
Thank you.